South Africa failed to get its act together on vaccines. That's the view of Professor Shabir Madhi. He says if the country depends solely on public sector control in the distribution of COVID-19 vaccines, it will fail dismally. Madhi says it's critical for the private sector to take a leadership role at the point of delivery. Government says the first batch of COVID-19 vaccines from India's Serum Institute will reach our shores this month. To discuss the story further, we are joined by Shabir Madhi from the University of Witwatersrand. A very good morning, Prof. I was reading your article a little bit earlier on. So would you say that this massive vaccine rollout plan is a tad too ambitious?
Good morning. So unfortunately, I think given where we are in South Africa in terms of vaccine procurement, as well as when it comes to having sorted out the logistics to actually deploy the vaccine, it is certainly an overambitious target. I think our focus really for the future, for the rest of 2021, needs to be centered around the immunization of healthcare workers and people at high risk of developing severe disease and dying of COVID-19, rather than being too ambitious and failing on multiple fronts.
Would you then say that the problem came with not doing the right kind of planning? Is planning where the shortfall was?
Exactly. To deploy a vaccine at scale, even to reach 15 million people, takes months of planning and not weeks of planning. Unfortunately, the Department of Health has only recently started to develop its plan to roll out vaccines. And rest assured, what we can't afford to happen as we roll out these vaccines is to experience what is, as an example, experienced by SASSA, by people that receive grants from SASSA, where they queue for hours on end to receive their payments or to sort out whatever administrative things need to be sorted out. We can't afford to have citizens have a negative experience when they go to be vaccinated, because that is going to even increase the reluctance to go out to be immunized further. We know that currently only 53% of adults in South Africa indicate they're willing to be vaccinated.
You also mentioned, and I want to just shift focus to the healthcare workers, the plan is to jab at least 1.2 million healthcare workers. You say that this plan isn't really a realistic one. Why do you say that?
Yeah, so I think it is possible to vaccinate 1.2 healthcare workers. What I was saying is that with 1.5 million doses coming into the country sometime in January or maybe February, that 1.5 million doses is not going to be adequate for 1.2 million healthcare workers, because all individuals need to receive at least 2 doses of the vaccine. So it might be adequate to give them their first dose, but that certainly would need to be then followed up within a 12-week period with the second dose. And those additional doses of vaccine need to be secured.
All right, now that we've identified some major hiccups in this big plan, what would you then suggest be done going forward?
Like I mentioned earlier, I think we really need to become focused, set realistic targets. And for me, a realistic target for the rest of 2021, considering where we are right now, is to make sure that we get the healthcare workers immunized as quickly as possible, and then to focus on how we're going to get those high-risk groups, those individuals at risk of developing severe COVID and dying of COVID, how are we going to get them vaccinated? In fact, before the next resurgence arrives. So this resurgence probably will start subsiding by about March, and then we would be in a relatively stable space. But in all likelihood, come around about June, July, we're likely to experience a further resurgence. And it's about making sure that we cover as many people that are at high risk of developing severe COVID before the next resurgence starts.
We're listening to Minister Blade Nzimande a little bit earlier on talking about how, the objective should be to create our own vaccines that are made here at home locally. Realistically speaking, is this a target that can be achieved anytime in this lifetime, anytime soon?
Well, it can be achieved in this lifetime, but certainly not anytime soon. I think the best case scenario is that it will probably take at least 2 to 3 years for a vaccine to be developed from scratch and to be commercialized. South Africa hasn't produced a vaccine that's been commercialized for the past 20 years. And to think that we're all of a sudden going to have the skill available to us to actually do such a thing at scale, even if the companies were actually to share their IP rights with the vaccines that have already been shown to be successful, that is just a starting point. So there will still need to be a huge investment And to set up the type of facilities that are required to produce millions of doses of vaccine is something which I believe people really underestimate. And unfortunately, it's not going to be the solution for COVID-19 vaccines for South Africa in the foreseeable future.
All right, thank you very much, Prof. That was Professor Shabir Madhi from the University of the Witwatersrand.